Good evening, Professor Rajendra. We would
Hi,
like to welcome you to the 2021 Innovators Summit.
thank you.
And I would give a brief introduction of the professor and then we will continue.
Mhm.
So, the title of his talk is Evolution of Digital Health in India and NDHM. Professor Rajendra Pratap Gupta is a leading public policy expert with vast experience in policy making. He has been involved in major global initiatives on digital health and holds several key positions in the digital health arena. He's the founder behind many path-breaking initiatives and organizations working for digital health. Professor Rajendra is the former advisor to the Union Minister, Government of India, and played a key role in drafting the National Health Policy and National Education Policy 2020. He was nominated by the World Economic Forum on the Global Agenda Council for Digital Health, recognized for his global contribution to healthcare by the Sheriff of Los Angeles. In 2018, he was conferred the Global Impact Award by the Personal Connected Health Alliance, a HIMSS organization at Boston, and his contributions and career have been chronicled as a case study in global health by the Royal Society of Tropical Medicine and Health for their Grow Global initiative. He is a member of the Guidelines Development Group Digital Health, global roster of experts in digital health, and a co-load of the Internal Committee for Scoping Out for Digital Health at the WHO.
Thank you. Firstly, thanks for giving me this opportunity, and it's great to be back at the HITLAB's annual summit again. So, what I'm going to do is walk you through a brief study that I did globally around 127 nations and what's the state of digital health, and then walk you through the journey of how digital health has shaped up in India, what has gone into making it, and also give you a brief about where we stand today and what does this transition for India look like, and what's unique about India's national digital health mission. So while I was writing my book, which you see on the side, the Digital Health Truly Transformational, I ran a study across 127 nations. It's very interesting to see how the world has moved during COVID, and it's going to be like beyond COVID. So this study I ran during the first wave of COVID, when it was peaking up. So this was between April and June 2020. And if you see this chart, if you take out this 3% number of I am not comfortable using technology, effectively we are closing to 97% in terms of people comfortable using technology. This includes clinicians, healthcare providers, and even users. So I think world has undergone a paradigm change in terms of how we foresee the use of technology. The interesting part is when you look at this study for patients seeking medical information, the place they go is the net. So which actually gives us a direction as to where we should be visible or available as providers when it comes to digital health. I mean, we have to be where our patients are, and they are on the net. So that's a very interesting finding. And when I led my another study, which was I think in 38 nations, this was during the time when the first wave was tapering off. We were heading towards the end of the first wave of COVID. So then I ran another study in 38 nations and asked people, so what do what led you to do what you were doing in the last 6 months, to reflect back, just to get a sense of like what did people see during COVID. So if you look at this study, it's very interesting that there was an equal need from patients and from providers both for digital consultations, which actually changed the entire game towards adoption of digital health. But what I was more interested in, where the forums like HitLab, which is a very influential forum to share on, like what do we want to do in terms of the impact of COVID-19? What are the future plans? So this is where I get worried. If you look at this 19.33 clinicians, they say we will go back to traditional face-to-face practice. And digital health is about ecosystem. We cannot have 8 out of 10 using digital health and 2 out of 10 not using digital health, because that defeats the purpose of technology driven care. So I think this is where those who are in the audience, those who are in the faculty for this forum, we all need to work together to make sure that that momentum which has been created by COVID for technology shouldn't fade with time. And that's my biggest worry, and that's why I wanted to make this particular part of the presentation before I jump to my key address. So yes, people believed also that I mean, like 74% say it will impact healthcare over the next 3 to 5 years, which is the future of health in terms of technology. This was again a 127 nation study. And if I look at the overall scenario, this all comes from the book. So I have, as part of copyright, put the book photograph. So if you look at before COVID, we were around here. During COVID, we peaked up. After COVID, we don't see much decline, but there could be. So that's the good thing for those of us who are very optimistic about use of technology. But again, those fence sitters we need to be careful about, because we don't want them to go back to the old paradigm of medical practice. So very clearly, as I look through the book and how digital health is, so the conventional ways of treating a patient are over. That's no more going to be, continued over time. We will have to use technology in the way we handle and treat our patients. So what happened to India? What made this big switch for India? And I'll give you a history of this. And I did play a role, and I'm very happy and lucky to be have been in a position where I could influence the transition and get the government prepared. So way back in 2012, I wrote this National Digital Health Plan, and that was like a 13-page document. It's on the web link that I put here. I wrote to the then Prime Minister that we need to have a complete digital health plan, because that has to be integrated across the continuum of care. So you can imagine how long a journey it has been since 2012, or probably earlier. This is the document I could lay hands on and how to impress upon the government about this. Then I again wrote a book in 2015, which again talked about the government should move towards a preemptive care model and a digital health plan. But the key time that came in was around 2013, when I was asked by this current government to draft the policies for all the sectors. And when I was drafting the manifesto in 2014, when I gave it a final shape, this is what I wrote about it: increase the access, improve quality, lower the cost. And talked about we should come out with the health policy. It has been a pretty long time, almost like, close to 2 decades, that we did have a policy. And what I wrote subsequently was this: that utilize a ubiquitous platform of mobile phones for healthcare delivery, set up the National Health Authority to leverage telemedicine, and set up standards and legal frameworks for digital health. So, well, this was my bit of putting the thrust on the policy, as the Narendra Modi led entity committed the country that this is what our mandate would be, should be from the government. And the again, a big moment came to me in 2017, when the then health minister asked me to look at and vet the final health policy. And when I looked at it, I was clear that there are certain things that we need to address, which we ended up doing. But what we did was page 32, where I ensured that digital health was taken care of from the ecosystem perspective. So if you look at this, it set the board loading, and with the amazing clarity of validating those words. Typically what happens is, in policy making, you give a direction. So I wanted to make sure there is no ambiguity. So you will see that I put the word first: ecosystem approach. That's one of the biggest differentiators for India in terms of the policy perspective. So I qualified that role of technology for health would mean e-health, m-health, cloud, Internet of Things, wearables in healthcare delivery, so that there is no ambiguity left. It's future proof as a policy. Then we'll set up the National Digital Health Authority. So you see that we have set up the Ayushman Bharat Health Mission. This has culminated into paradigm change for the country. And we talked about the federated health exchange, unique health ID, and all that. So I'm very lucky to see that what was enshrined in the policy is a reality today in terms of the world's largest program for digital health. I was also very lucky in terms of seeing, the e-Sanjeevani thing, which has been there for a decade with CDAC. We started the teleconsultations from this platform in 2020, and we actually crossed 12 million consultations. So for me as a policymaker, I think the proof lies in delivery. And when I look at the numbers, I believe that India has just started. We have a long way to go, but still the numbers convince me that we probably will be number one in the world when it comes to digital health. We would not be number two. I'm pretty sure about the way I've been seeing and I've been addressing the ministry meetings that have happened. If you see the Ayushman Bharat Health and Wellness Centers, So we decided to convert the sub centers and the rural centers into Ayushman Bharat Health and Wellness Centers. And one of the integral components is the telemedicine facilities. You would have seen during the launch that happened on the health and wellness centers. Almost 50 of them were launched in April 2020. And this is also one thing that those who have not read, almost 5 years ago, we had done the standards for remote health management. So, various things that we did under different ministries. This happened in May of 2015 when I was a part of this committee of the Ministry of IT to draft the guidelines for remote health monitoring. So we had done the groundwork so that when COVID struck, that we were not scrambling to figure out what we were to do. We had the entire gamut of what we wanted to do as ready. So in fact, one of the other big breakthroughs was for India, and this is the time when I was actually serving as advisor to the Health Minister of India, that we were the first country to propose a digital health resolution at the World Health Assembly in 2018, which was unanimously adopted, which also brought a focus at WHO. And now we all know that WHO has a separate department for digital health. They have a CIO, and there is a department for capacity building for digital health. So I think India catalyzed many things at the global level, at multilateral bodies, and back home. So it was like a multi-pronged approach to address digital health. Even on AI, if you look at India released the AI strategy for health was also a part of it June of 2018. So we were actually preparing the building blocks for digital health in various ways, addressing the issue of AI, the unique ID, the teleconsultation platform. And this is the document released in June 2018. I guess the chapter 7 is the one that addresses health. So we have still a long way to go, but what is very exciting is how do we look at India's adoption of digital health. So the entire Ayushman Bharat digital mission was launched on 27 September this year. It's national mission that we are looking at in terms of providing digital health. But why it is different? Why it is not just a mission? And that's something that we need to understand from the policy lens, as it was envisioned. So let's look at the numbers. The Covin app, the Arogya Setu app had 200 million plus downloads. That probably makes it one of the most downloaded apps in the world. More than that, 1,000 million vaccinations have been done through this app. So those who have had vaccinations like me, both the doses, I have an electronic certificate on my mobile. I can look it up anytime and I can show it. I don't need to carry a physical certificate. All has been done through technology. So for me, the proof of what we envisioned way back in 2013-14 in terms of policy, and then in 17 as national health policy, has finally culminated into what we are seeing as end results. It's huge. If you look at the hospital admissions, I mean, as on 16 November, we had almost like one admission every 3 seconds. If you look at the total number, we had 22 million hospitalizations under the biggest insurance scheme, all tracked digitally. So 12 million plus consultations on e-Sanjeevani. These are digital consultations. We have a national medical college network. We have a national license for snowbend CT for people to use in the country, paid for by the government. And we are now launching the new program, which is funding 75 startups by the government of India under the BIRAC. So that again completes our entire ecosystem of us setting up policies, setting up programs, and funding startups too. So I think that's a very unique way to look at digital health from a government standpoint. What is India's approach to digital health? As I told you, we committed that in the national health policy. Then we ended up putting a systems approach so that we don't address it in bits and bytes, but we look at a complete ecosystem and then address digital health. So the biggest another change is institutionalized approach. So we set up an institution, the National Health Authority, the Ayushman Bharat Digital Health Mission. So which effectively means that even bureaucrats come and go, the institution will keep going and doing the work as per the mandate. So that's something that I've always believed, that we should have an institutional approach and not just a program approach, because program can go with the bureaucrat not liking it, but the institution remains in existence in perpetuity. So for me, this was the biggest contribution of institutionalizing the digital health rollout in India. Then we had standards before the programs. As you see that we had developed the telemedicine guidelines. We have still, drafted the standards on digital health. There's a unique health ID. I think People in India have now started creating their own unique health ID. I created last year. So that gives us a sense that we have addressed the basic building blocks. We have put health and wellness centers as our outreach for digital health, and then e-Sanjeevani, which is programmed and made to handle 500,000 consultations a day, which effectively means we would be the world's biggest digital health consultation platform in the world. Today, it's like we have done total of 12 million plus consultations. And the best part is this entire ecosystem approach is the government is working with private players too. So it's not just the inside thing for the government, it's pretty open minded. There is a sandbox approach. So we have some exciting stuff happening in the government on the digital health space. So I think it's time for us to make India a world leader in digital health. And I wanted to be brief to share about what we are, and I have captured most of the things in the book that I wrote. And thanks for giving me an opportunity to be on the HITLAB Innovators Summit. It's always exciting. And thank you, Irfan. Thank you, Stan.
Thank you so much, Professor Gupta. Do you have 5 minutes to take questions from the audience?
Happy to do that.
Sure. So, the first question is, how can we incentivize providers and other important stakeholders to not go back to traditional ways of delivering care?
So first is, Irfa, that we need to first make them understand the benefit. There are the what I call in digital health, the biggest thing is that we have technical maturity. Tell me a challenge in healthcare, there will be 10 solutions. But what is missing is organizational maturity. There are not organizational competencies to leverage that. I mean, I foresee that, at one side we are having so many consultation, but how many people have we made ready to technically handle this? So I think we have to create. And second thing is we need to document the evidence that talks about the success of this. We are probably very poor in writing the WHO guidelines. I felt that one of the biggest challenge we had is we had either no or low evidence for most of the things. We need to document evidence. Once evidence is there, clinicians always adopt it if it supports adoption.
And the last question, because in the interest of time, I think I'll just take this one. So the question is, you mentioned India will be number one in digital health. By when can this goal become a reality?
It is already as we talk. So I'll tell you, I also was a part of developing the Global Digital Health Index. We probably didn't figure anywhere, even in the middle rung then. But look at the things that we are doing. The latest decision taken by the government is the government will hire people at market rates. And there's a huge budget allocated for that for the Ayushman Bharat Digital Mission. So in terms of numbers of what we are doing, we are already number one probably if you look at. And I guess every month you can keep looking at the numbers and they'll only grow. I'm very confident of the institutional approach and the right set of officials at the helm that we will make it. We are already with 1,000 million vaccinations through an app, and 22 million downloads of Arogya Setu and consultations that we have done. I think we stand to be number one for now.
Thank you. Thank you so much for your time. It was great listening to you, and thank you again for coming here and
Thanks
speaking
for
at the
having
summit.
me. Really appreciate that.
Thank
Thank
you.
you.